On the Scene video coverage of ESC 2012 is supported by Pradaxa.
I'm Spencer King for On the Scene here at the European Society of Cardiology meeting, where we are hearing about the FAME-2 trial. This trial, probably more than any others here, will stimulate an enormous amount of discussion throughout the cardiology community. The trial is using fractional flow reserve in all the patients to identify those with high-grade flow-limiting lesions. If they have high-grade flow-limiting lesions on the FFR, then those patients were randomized to either continued medical therapy or stenting. Another group who had no positive FFR were followed in a registry. And the trial showed that the stented group did better. Why? Because of a decreased incidence for admission for urgent admissions, most of it for revascularization. These patients did not have increase at the short follow-up that we have in death or MI, but they did have many more readmissions. And so the Data and Safety Monitoring Committee stopped this trial after enrollment of over 800 patients, and those have now been followed for shorter time than would have been the case had this trial gone to completion. So what does this all mean? This is good news for the interventional cardiology community if you favor revascularizing the patients with a lot of ischemia. On the other hand, there will be a lot of criticism because the main endpoint of this trial is readmission for an acute syndrome. So a lot of understanding about what that acute syndrome was. About half those patients had enzyme changes or EKG changes, but that means half of them did not. And so with an unblinded patient, is there a bias toward readmitting a patient who's been stented? This will be a question raised. Another question is, of course, the stented patients were treated with double antiplatelet therapy, and the patients treated medically were not. So we're going into a great deal of discussion, I'm sure, about this trial, and the question of what does this mean, how will this drive practice, is going to be a critical one. The use of FFR by documenting that these are patients who indeed have large vessel obstructive disease is very important and may have selected out a group of patients with stable ischemic heart disease who indeed will benefit from revascularization. And that's what perhaps was not present in COURAGE and all the patients. And so this trial may have brought us to better focus on the kind of patients that will truly benefit from revascularization. So I'm Spencer King again, visiting with you on the scene here in Munich at the ESC meeting, and we look forward to talking with you in the future.